Hey guys, and welcome back to another episode of the Body Wisdom Podcast. So excited for you to tune in today for a very special episode. I'm sharing a conversation that I had with Faith. And I actually met Faith recently, a few weeks ago. We have a mutual friend who has been dying to introduce us. She's always been telling each of us how much she thinks that we have in common and how much that she thought we would get along. And so we finally met in person a few weeks ago. And yes, she was absolutely right. I fell in love with Faith, and it was so nice to just talk with her and hear all about her wisdom. And I think you're all going to love this conversation so much. We actually also have the same last name, which is hilarious and crazy and just shows you that everything's all aligned. Faith is actually a registered nurse with a background in surgery. She works during the pandemic in the hospitals and just became so passionate about sharing her holistic tips that she has for all of her patients to keep them out of the hospital. I love her holistic approach that focuses on mental health and stress first and foremost. She has a really balanced approach to nutrition, using movement as medicine, and rest and play for thriving health. So now she sees patients in medical aesthetics and treats their skin, scars, and outer health, while focusing on how they become healthier, starting from the inside. She also just started taking patients virtually for online holistic health coaching, and I'm really excited for you all to hear more about her offers. So I'm excited for you all to tune into this episode. Let me know what you think. I'm so excited to have you on this podcast episode, Faith. I was talking in the introduction about how we had a mutual friend that introduced us. And like for the longest time, she was like, oh my gosh, you guys have to meet. And she refers to us as like the Beyer girls and everything. So
last name, yes.
Yeah, I know. Which is, it's crazy because I mean, Beyer is kind of a common last name, but not that common.
So. I know, I haven't heard it. So it was funny. And it's fun that we got to meet so briefly. So it'll be fun to catch up and talk about all the things.
Yeah, yes. So my first question for you is, I would love to just hear your story because I know that you also were working in the hospital in the pandemic, and that really inspired you to help teach your patients and help, your patients learn how to stay out of the hospital from a holistic approach. So I would just love to hear your story and a bit about you.
Yeah. So I grew up in San Diego, went to nursing school in Texas. So that's how I ended up in Texas to start working there. And then when I started in the hospital, it would have been 2021-ish. So that was kind of like the heat of COVID was more 2020, but then 2021 still going on. And there was a lot of nurse burnout, which, like you said, of course, the preventative health for the patient standpoint, but then also just all the nurses that I was around and seeing everyone in that fight or flight mode for so long. That was huge to me when I started realizing how, self-care so that you can be your best self at work. Just watching everyone I worked with, not getting sleep, taking extra shifts, overloading themselves. So again, preventative health from the patient population I was seeing. I was working in general surgery. So it was a lot of diabetic patients. So there was a lot of like nutrition and lifestyle education going on. And then it was a lot of, more basic stuff like appendectomies, or it could go all the way to surgical oncology. So it was a really wide-ranging patient demographic. Some of those things were, preventable lifestyle diseases. Some of them totally weren't. So to me, it was learning how to meet everyone where they are and find those commonalities of, like we've talked about a little bit, stress management and just all the things that can help your body heal. In the surgery setting, you need rest and good nutrition, and those are things you don't get any of in the hospital. So that kind of initial experience was really pivotal in wanting to switch out of the hospital to, talk with people about more preventative health.
Yeah. Oh my gosh. And just like what you talked about with, there's so many reasons why people eventually are led to having to be in the hospital, having to get these surgeries. And so I know that you are so passionate about helping people learn how to take care of their bodies from a really holistic place. And I would just love to hear more about some of the things that you saw, like with people living in that fight or flight mode and just like the effect that it had on their bodies and even from, working as a nurse and like the healthcare profession as well, and just some of those things.
For one, like nursing school in general is any type of healthcare job, the schooling that you have to do is always stressful. But it was so accepted as normal to be running at those extremes and staying up till 2 or 3 for a test the next day. And so when I started in the hospital, it felt like normal to me to be running on those like highs of just go, 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 drinking a bunch of coffee, staying in that mode. And so probably the biggest lesson I learned in the hospital is that I couldn't take good care of people when I was crashing or too tired or, drinking too much coffee and feeling anxious. And so it's interesting. And that's why I love your work too, because you make such good points how you can be functioning really well and doing a really good job at work, but then things catch up to you. So for example, I would work in the hospital, have a 12-hour shift, and I was on it. I'd be really, really good. I'd be like on it, but then I would crash. And on my days off, so as a nurse, you might have 4 days off, which is great, but you need to recover and rest. And on my days off, I would start getting panic attacks, which I hadn't experienced before. And those would happen like in the grocery store, like somewhere random. And so I learned so much about how when you put yourself in that mode and then you come down from it, what your body can keep firing off. And as much as that wasn't, fun to experience, it taught me a lot about nervous system regulation and all the important work that you're doing. So that is something that I'm really passionate about, helping other nurses and any busy professionals or busy moms or busy people talk through, because I think that's the starting point. It doesn't, we can't talk about nutrition and exercise if your body is in that stress mode. So that's why I'd rather people go see you first and talk about getting through that stuff first, which is kind of like, the basics of where I think people should start with their health.
Yeah. Oh my gosh. That's so true. And actually what's so interesting is that you can't even learn new information, like if your nervous system does not feel safe and if you're constantly in that go, 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 fight or flight, like taking in any new information is just going to like go
for sure.
over. Yeah.
And so many new nurses, I think, are in that position, or new healthcare workers, new therapists. There's a lot of that.
Yeah, absolutely. And something that I love picking your brain about is, of course, skin stuff and just, learning how to feel your best self so that it gets expressed through your skin. And I would love to hear more about what you see, like that correlation between being in chronic stress and how that is expressed through our skin.
So yeah, when I finished working general surgery along the same time, I started working with an aesthetic nurse who worked in dermatology and did lasers and skincare and all that kind of stuff. So hospital, I was still doing like wound care and healing skin in the most extreme way, but then also seeing people just wanting to improve their skin and get rid of wrinkles, So it's like this really extreme kind of thing where at the end of the day, whether someone's healing from a major surgery or someone's trying to improve how their skin looks, the basics are very foundational and all the same. So if your body's, like we talked about, in a stress state, it's not going to be putting all of its good resources and nutrients towards improving, hair, skin, and nails when it's just trying to keep you alive. And so the stress buildup, there's so many different ways, whether it be, inflammation and raising overall either local or systemic inflammation. It obviously affects your gut health, and your gut is so closely correlated to your skin. I think people know about the gut microbiome, but there's also a skin microbiome and a barrier and a really delicate balance that you want your skin always within. And so whether it be right now, I have girls in their 20s all the way to women in their 70s. And so our whole life, we're also going through all hormonal changes. And so stress is always at the forefront of so many hormone issues as well. So I think for anyone, whether it be hormonal acne, when I was working in COVID nursing, I think it was a lot of the mask, but really bad acne breakouts. And I think that was really stress related. So a dermatologist might say, here's a bunch of antibiotics and, here's a prescription for Accutane, or here's spironolactones used for hormonal acne. But to me, the holistic approach is nice because it allows you to look at the whole mind and body, because that is going to directly reflect on your skin.
Maskne. Oh, maskne was the worst.
So bad. And there, yeah, looking back, like, I don't really know what else you could have done. I mean, I know some people that put, some microbial or antibacterial, some sort of spray in there, but the mask and the hot air and all that stuff. And then, like I said, stress, it's crazy how much that can show itself. And I think it is a lot of inflammation. I think, there's so much buzz talk online about like cortisol right now. And I don't know much. I think it's interesting to talk about, but it's like that increase in cortisol and holding on to water and inflammation and poofiness that people call it. So I think there's a lot of truth to that. But I think that it also, we might overuse that term too, because I think that cortisol, yes, there is some issues with people and cortisol, but I think it also comes down to nervous system regulation, which doesn't always need to mean that we have to perfect our hormones. Our hormones, are secondary to figuring out our basic fight or flight.
Yeah. Oh my gosh. Yes. Yeah. I was going to say that like it was such a trip working in a hospital when we were all having to wear masks and whatnot because of how much like craziness that happened with our jaws as well. But that's a whole other story. But what you just said was, oh my gosh, a little bit ago, you just said that your skin can't really heal itself if it's like just trying to keep you going in this and get you out of this like stress loop. Like your body is going to decide what it needs to focus its energy on. And that I think was super powerful what you said. And then also, I do think that there is this huge obsession with cortisol right now. Our bodies are designed to move through stress responses, and we can't just like live on an island, like floating around on a raft, drinking a pina colada all the time. But I feel as though, like what are your thoughts about cortisol? And
well, I think that again, it's a buzzword, but I like that at least people are talking about it, because at least it's bringing stress to the topic. Because unless you get your hormones done through labs and checked, you can't just diagnose yourself with high cortisol or know what your hormones are doing. So I think a lot of people are saying this is how I was experiencing, but it's a lot more than just cortisol. I do think that there is a lot of women that might fall into the category, women and men, but over-exercising and overdoing it. And then their body is starting to, start to increase inflammatory markers and all these other things. And that's just a stress response overall. And where cortisol might be a part of that response, it's a very wide-ranging response, as you know, and I'm sure you talk with people on, there's so many different little facets to what happens in a stress state. So I think it's really nice, especially if people are concerned about their skin. They might think they're doing all these amazing things for their health, and they are, but they might actually need to back it down more than they think, So sometimes that less is more. I experienced that when I was doing COVID nursing. On my days off, I was trying to keep myself busy, and keeping yourself busy just keeps you in that mode. And so I almost had to like fully retrain myself on how to relax for real, and not relaxing like going to a workout class, but like actually relaxing and not being, around all this stimulus that we're always around.
Yeah. Oh, I love how you describe that. And you're right. It's so much more complicated than just like lowering cortisol, or there's so many things that happen in our body. But finding safety with even just relaxing is definitely something I feel like we could all use a little more of. But I'm curious as well what you recommend like to your clients and whatnot, because I know that we're all looking to, have better gut health. And I'm curious what some of your like go-to tips are for improving our gut health.
Yeah, I love the topic of gut health, because I think that's another like buzzword thing that people say. And it for some reason gets always clumped in with like all these fancy powders and new things and things you should be doing. But I think it's really nice to remind ourselves that really your gut and all those good bugs, you're obviously trying to feed the good bugs. And that starts from everything we eat to things that we're surrounded by to stress. And so you don't need like a fancy powder to perfect your gut health and all these things. You kind of just need more of the basics, which, when you're talking about gut health, we know that real food that our body can recognize versus more processed food. I'm always careful with that because I think that there's also like this extreme stress around processed food. And I think that people are also overdoing that too. So I think it's a really careful thing right now with social media and health, because you don't want to create like a paranoia about certain types of processed food or toxic this and that. But I think that from a health and science standpoint, eating real food, fruits and vegetables, colorful things with lots of nutrients that help feed your gut the good stuff to help process everything well and to help get rid of wasteful and toxic things in our system, as well as exercise. Exercise is considered like one of the best pre-probiotics. And I know you like to do a lot of yoga. Yoga is a great one too. You're sweating and releasing, old stuff. It's very mind body. So it's obviously a stress reliever all in one too. So I think that it's that everything in moderation. When you're looking for better gut health, you want balanced nutrition, a balance of exercise, because you can overdo it or underdo it. So anything in the gut health department, it's not like I recommend this one supplement or this one, greens powder. It's really, are you going back to the basics of good nutrition, stress management, and movement as much as you can, with incorporating rest as well.
Yeah. And I love that, because it's really something I feel like people will feel really comforted when they hear that, because it's like, you don't have to go out and buy something, because it is really overwhelming to look at how many supplements are out there that supposedly can help you heal your gut health and improve your gut health. But it really, like, those tips that you provided are just like so nice. You can start incorporating those now and just really begin to day by day improve your gut health, which then, helps your ability to regulate your nervous system.
Yeah. Do you guys talk a lot about gut health with your client population?
Yeah. Yes, absolutely. Because it's one of those things that it all just kind of goes hand in hand, and that when you are living in that chronic stress, fight or flight mode, or if you're in totally frozen shutdown mode, it really does affect your gut health. And so they just go hand in hand. And then, of course, your vagus nerve innervates your gut. And actually there are neurons that are found in your gut. So your gut really is your second brain. So when it comes to being able to regulate yourself through a stress response, having, the best gut health possible is super important.
Yes. And I think people, especially with anything mental health wise, like anxiety and depression and all the things that are so common, I don't think people realize how much that does have to do with your gut health as well. And so I think that when you learn to tune into your body and listen to it really well, I feel like that's the first step, because you can't listen to your body if you don't know how to be in tune with it. And so again, going back to like the COVID thing and the anxiety stuff, like if I didn't experience that, then I wouldn't, know or learn as much about how to listen to my body and know when those little physical things are coming up and how to work with that in your mind. So I feel like what you do for work is so crucial and important, because it's really helping teach people how to be in tune with their own system.
Absolutely. Yeah. And we can sometimes look back at those events that we went through and really just learn so much about how to better take care of ourselves and, do the best that we can so that we can have more control over our physical health, because there's so many studies that show that when you are able to regulate your nervous system, you decrease inflammation in your body, which then helps you stay away from some of those like chronic illnesses and disease.
For sure.
Yeah.
And then, with skin and inflammation. So, acne is a big one, obviously, but psoriasis, eczema, there's a lot of inflammatory skin issues. And so whether it be an inflammatory skin issue or aging, both of those things are affected and accelerated by increasing inflammation. And so even if it's someone who feels good about their skin, but they're just worried about being, preventative with aging, stress is one of the biggest accelerators of aging, And so the studies show how it accelerates the breakdown of collagen and elastin and all those good proteins that hold up our skin. Someone I heard on some podcast, they were talking about, you look at some presidential candidate and then someone that has been doing that high stress job as the president of the country and what they look like in the beginning and the end of their however long term. So, we know that high stress speeds up aging. And there's so many people wondering about what they can do for anti-aging now. But that almost is like counterintuitive, because if you're so stressed about aging, then you're speeding up the process of it. So I think instead of being concerned about aging, it's more, how can you feel your best right now? And then how can those tools be things that you use like for the rest of your life, and not little, quick fixes, because we all like things instantaneously as well.
Yeah. Yeah. Oh, that is such a good reminder about how much stress does impact the way we age and everything. And I talk a lot about how it impacts the way that we like carry our bodies. And I think that it affects like our posture, which also can affect like your facial muscles and just like the tightness in your shoulders. And I'm curious with what your experience is of that when you see patients come to you in the office, and just like kind of how they're carrying their bodies and how that might impact their skin.
For sure. So a lot of the injectable patients that we do, so a lot of times people think Botox and they think of just, wrinkles, but it's actually, a drug that was made for 10 or 11 different therapeutic uses. So they use it for overactive muscle disorders like bladder spasms and all these more intense medical issues. But when you think about the face, you hold a lot of tension. We like right in between the eyebrows. We're always scrunching at screens and stuff and squinting in the sun. And so a lot of people with strong muscles, the scapula muscle here, will hold a lot of tension. They'll get headaches. So that's something I can see right away in how that their rested state is. You can see even at rest if someone's holding tension here or they're clenching their jaw. And so just like you would if you're sitting like, crunched up in the shoulders, it's you think of all the facial muscles, and there's so many of them. When they're constricting and feeling tight, there's so many therapeutic uses, whether it be teeth grinding or migraines, that you can use, these medications to release tension. And so a lot of times it gets a bad rap, but it's actually can be a really tension relieving therapy for some people. So many people run in for their quick appointment, like, they're frantic, and you can tell right away when someone's in that stressed mode. So it's nice that they're at least taking some time to do some self-care and do something for themselves. So it's nice to kind of slow them down and get them in that state, which I'm sure you have to do a lot of too.
Yeah, absolutely. And it's definitely like that combination, and being able to, the more that you can relax in your body, the more it's going to help your facial muscles relax. And then there's also different things that you can do, different tools that you can have that also kind of help your muscles relax. And it's just, it's important to kind of know about how much they affect each other and all of that.
Yeah, dropping your shoulders, like when I'm stressed at work or I'm doing something with a patient and I feel myself getting tense or like a little flustered, the second you drop your shoulders, like just feel like you feel more confident. It just promotes overall relaxation. And I love that you have the background of doing yoga teaching, because I feel like that's the most mind and body thing that there is too.
Yeah. Oh my gosh. Absolutely. And it's like, it doesn't even have to be this like big thing where you like try to relax your shoulders all day long, because that would be so difficult. But just like being able to recognize when your shoulders are starting to really creep up, so you can just relax them down, and like developing that body awareness.
Yeah. And those are the exact little tools that I think that people need, because I think when they think of like this health journey, they think they have to do all these like extreme things like multiple times a day, or like meditation has to be like 30 minutes a day or an hour a day or in their every morning routine. But really it should just be this little tool in your back pocket where you can do it for 2 minutes or deep breathe for 30 seconds. Like that can count as your breath work, your meditation. It doesn't have to be this lengthy thing. And it's going to be a lot more beneficial long-term if you just have those little teeny tricks when you need them.
Yeah, absolutely. I would also love to pick your brain, kind of going back to that topic of like cortisol, acne, inflammation, all of that, and just kind of pick your brain a little bit more, because I know a lot of people have questions about acne and finding safety in the body so that they can heal their acne. I'm wondering if you have any tips about a holistic approach to healing acne.
Yes. So I would say that it's very age dependent. That's one thing. So let's say in your early 20s, I would even say 18 to early 20s, you might be dealing with female hormonal acne. And so when you are dealing with acne, one helpful thing is, where is it presenting on the face? If it's in your oily T-zone area, then we might think that it could be more bacterial related or product related or related to excess oil production. If it's chin and jawline, which is where I really got it bad when I was COVID nursing, and then I think just a lot of it was hormonal in pattern too. So the first step is like, where is it happening? Is there a pattern to it? So obviously, if you're getting a flare up right before your cycle, there's a good chance that it's hormonal. Is it cystic? Is it painful? All the kind of, not so fun questions, but kind of determining where and what the patterns and kind of symptoms of it are. And then I would say, so again, if you go to a dermatologist, they might say, here's antibiotics. Antibiotics are also really harmful to the gut. So I always see people going through that pattern of antibiotics, not good on the gut health. Then that kind of is, not helpful for the skin either. And so if you can, the first thing I would do is approach the skincare as a less is more. I would go like almost cold turkey on products, because I think when we have acne, we always want to say, what can I put on it to make it better? And I did that same thing. And you're using like chemically exfoliators and you're just trying to rough it up, which can actually increase the inflammation and irritate it further. So it's nice to step it back and use a really gentle cleanser and a good moisturizer and call it a day and do less. And then I would say nutrition would be the next thing. So dairy for a lot of people is super inflammatory, but not for other people. And sometimes there's people who do really well with raw milk and raw cheese and different forms of like really concentrated non-processed dairy, and then, break out really bad with more conventional dairy. So I think that this is also where people get confused because they see this stuff online, and until you take a food sensitivity test, which I think is a really helpful tool, you can try to track and do elimination diets. That's really hard to do though, because it's really strict if you're really trying to figure out what foods might be causing, this inflammation. But for most people, dairy, whey products, there's a couple like popular ones that do affect people's skin and make them break out. So you could try eliminating those and see if that helps. A lot of people, they hide in their protein powders and they don't even know that's an ingredient. Then they try a new protein powder and or X-nay the protein powder and find that their skin improves. So you can trial with those big triggers that sometimes people deal with. And then I would just go to the basics. We know that sugar is really inflammatory. Again, I'm all big on balance. So I love my chocolate and my, stuff just as much as anyone. But I think that if you are dealing with something inflammatory, that we know that that's one of the biggest causes of inflammation. And then the third thing in nutrition would be blood sugar stabilization. So making sure that when you're putting together meals and even snacks, thinking about protein, fat, and fiber, because those things we know are going to help stabilize our blood sugar and not do a big spike and crash. That also is really helpful for mental health too, because it helps you feel more stable throughout your day. You don't get those jittery, up and down blood sugar spikes. I think that there's just like a lot of positive in that department. The blood sugar thing is because when you get those spikes and crashes, that leads to more collagen breakdown and that can create inflammation. So there's just this idea that you're putting, good things in your body that'll help keep you stable, and that will help overall keep that inflammation at bay. So I think those are the biggest things that I think of.
That was so powerful because again, like there is so much confusion out there, and we live like in this world where sometimes we consume a lot of information on Instagram, TikTok, and it can be so confusing. And I just love that really broke up a lot of that confusion and just gave some actionable tips to really just be able to implement now, instead of being like, oh, I need to do like this.
From, doing nursing, like you still look online and you're like, oh, you buy into stuff really easily. Mm-hmm. And like one of the things I can think of like trend wise is intermittent fasting. And then there's some like health professionals that say, and there is some disease processes that the intermittent fasting is a therapy, used for that. But for like your typical busy professional person that's, not eating breakfast till noon and drinking coffee, like that's another thing you'll see on social media. But that is, when you think about it, not a great setup for your skin, because it's increasing your cortisol. So cortisol, it's getting brought up again, but
Yeah.
that is one of those things that I know that when I did that, not on purpose, but just from being busy in a nursing school, you don't feel good and you crash. So I would say like starting your day with a breakfast if you're not eating breakfast, and really being attention to caffeine and alcohol as well. Caffeine, I love coffee. I try to not do more than one, and matcha is a great alternative. There's so many other ways to get, some good stable energy, but caffeine and alcohol are really big ones on the skin as well because of the inflammatory response. And alcohol is a whole, different thing, but that moderation concept with all of these things is huge. So when I see, a girl in her early 20s who's still in the phase of, lots of partying and then she's worried about her skin and skipping breakfast. Like there's just so many little things that you want to help someone with that might set them on a better trajectory. And so those are just things to think about that I notice in my patient population.
Yeah, again, I feel like it really just helps break up a lot of confusion and it just makes so much sense. So I really love how you describes that.
I'm so curious about how you work with patients too, and if they have skin concerns and if they have what your main demographic of people is, I guess, too.
Yeah, I feel as though there's kind of like two things that I see. Obviously there's people that want to learn how to, regulate their nervous system so that they aren't feeling triggered all the time and they just feel like safer in their bodies. And then they also want to learn how to regulate their nervous system so that their inner glow is also showing on the outside too, that they're glowing so much from the inside that it's kind of like showing on the outside, or they're like having a glow up, or, just feel confident in themselves, confident in their skin. Yeah.
And I love that because I feel like that's what like in the beginning, like I would want someone to go see you first because you're so good at that and talk them through that first and foremost before like doing any major health changes. Cause I just think I just feel so passionate about it because of what I experienced with hospital stuff and dealing with that whole situation. Like there's no way that no matter what I would want to do, like with nutrition and exercise, like that doesn't matter when your body is just so panicky all the time. And so that's something I wish more people realize, because we're just in a world where there's people want the quick fixes, but they don't really want to do the behind the scenes work with their health first.
Yeah, definitely. Do you feel as though you see kind of a lot of people just like kind of wanting that Band-Aid fix where they come in and they just get a treatment and then it's like just a Band-Aid?
Yeah, I would say I get that a lot because it's patients when you want to improve your skin, you obviously want to do that overnight and you want it to, look great. But if you can come in and do all the treatments in the world, but there's like even just like being hydrated enough. I can do all the, lasers and microneedling and all these things to stimulate collagen. But if you're not hydrated, from the inside out and getting at least a good amount of some basic nutrients that your body's functioning well, it's hard to get people quick fixes. And to me, I always think of things like very like deeply when I see patients, because they're thinking about their skin, but I'm trying to figure out like what's making you want to feel better, or what's like what is it really that we're trying to seek? Because if someone's coming in and doing things like overboard and doing things that look unnatural, I'm kind of always wondering, and it's not like, I'm not a therapist, but just from my nursing mind, I'm always like, you always wonder like, what is there deeper going on? Because there is a lot of body dysmorphia in our industry, and there is a lot of that going on. And of course, it always stems from something else. And so you always are curious about that, and you can't save the world and like fix every patient and know what they have going on. A lot of it's rewarding stuff too, though. Like if someone comes in and they've been struggling with their skin, but then they also say that they have had major life events going on that have been really difficult, then it's really rewarding to do something on our end that like makes them feel better on the outside.
Yeah. And something that you've talked about before, which I so agree with, and I love people like you that bring more light to this, but is the fact that AI and filters and all of this stuff, like is affecting the way that we view what a normal body is supposed to look like.
For sure. Yeah, I mean, that's been going on for years, but like you said, the AI thing's a little bit more prevalent now. For sure in my industry, I mean, I'll have people come in and like show me a picture of them like with a filter and say that they want to look like that. And it's just like, I know a lot of people in my line of work like post a lot of before and after pictures. And when I first started, I was doing more of that, but then it just felt like not the message I was trying to send, because I know people want to see outcomes of procedures and treatments that we're doing. But for one, I think it's like a very big comparison thing. You know, I think people are like, oh, I want to look like that. And it's like, well, everyone's different. But I also think that I just want people to look and feel good in person. Like, I don't really care about like the Instagram before and afters. It's like this crazy dramatic thing, because that's not really what you're going for in real life. Like half the time people are coming in for something to improve their skin. They don't want people to really know about it. They just want to feel better and look better. So it's just an interesting thing, because I know a lot of people who are really well known in the industry really hit the before and afters hard, but that's just not what I'm going for. You know, I just want people to feel good in person, to feel like they can feel more confident in a job interview or on a date, which is like my favorite thing when people say they like, you know, stuff like that. That's what makes me happy. And so I know that, again, it's like a popular thing, but I think that it just promotes like a further comparison game. And it's really like, I could care less what my patients look like if it makes them happy. You know, I think it's just about what you feel like, not what you look like.
Yeah. Oh my gosh, totally. And I just feel like that grounded approach that you have is just so amazing. And I'm so excited to see you step into offering more holistic coaching with your nursing background and everything. And so I just want to hear a little bit more about that and some of your offerings that you have.
So I've been thinking about it for a while, because there's so many health coaches online. And I think it's kind of crazy how unregulated that it is. Like, it's crazy how anyone really could be a health coach. Like, it's kind of concerning, but
yes,
I've always thought we should have more nurses in that space, because that's all we do in the hospital is teach people what to do when they go home, and teach people, but you only have like 30 seconds to do that. So I want just more time to talk with people. And so my goal is like anyone that I would see in aesthetics to help them improve their skin and feel better on the outside would be to have the availability to do, you know, online sessions for health coaching and holistic health coaching, and set that up in a way where we have more time to talk about the whole picture of things. So if you come into me and we're doing a treatment for acne, because we have laser treatments and more, you know, microneedling treatments and things for acne, but I don't have time in that setting to ask you about, you know, your stress and what are you eating and how are you exercising and all that kind of stuff. So this is where that gives the opportunity. So the way it's set up right now is just a 30-minute kind of consultation online. I know that a lot of people, there's different questionnaires and applications, but I kind of like the face-to-face part. So people just hop on a quick 30-minute call. We do that. And then we go forward talking about how many times, whether weekly or monthly, that we'll meet just like this on Zoom. And I think it's so cool. It's so accessible now to be able to meet with people online. And so it kind of hopefully will just make holistic health a little bit more accessible as well.
Yeah, love that so much. And can people find you through Instagram to sign up for the consultation?
Yes. So I have Instagram, and my tag is just Nurse Faith Medical. And then my website is also nursefaithmedical.com. So there's the consultation links on both of those pages, trying to keep it simple. And then I have a podcast as well, which is fun, because it's a fun place to talk for a while about a certain subject too. Like I was telling you, more fun to talk conversationally with someone else. So it's fun to do together. But
yeah, I love your podcast, and I will link all of that in the show notes, and so people can go and find you there. But okay, my last question for you is a selfish question, because it's one for me, and I think other people might have this question as well, but I'm so curious, because we talked about supplements and there's so much you can do where you don't necessarily need a supplement, but do you think that it's worth taking collagen as a supplement?
Yes, good question. So I like that question, because I do think that it's worth it. There was a study that came out just about like multivitamins in general. And like, I think it's interesting, because where they say they don't increase lifespan, like that's not what people are going for with the multivitamin. You're trying to like make your hair grow more, or you're trying to, you're going for quality of life. So with supplements, I think there's a couple important things. Is that if you're going to supplement with collagen, it is a form of protein. And so your same thing like we talked about with nutrition and nutrients in general, you want to make sure that you're getting a decent amount of dietary protein in general from your food, in addition to collagen. So that is because your body is going to receive protein and want to use it for building blocks, like your really important things like your heart and your lungs and your internal organs. So if you have enough protein at baseline and then you supplement with collagen, then you're going to get that boost because your body's going to have enough to send out to hair, skin, and nails. So dietary protein, first and foremost, getting whatever, the recommendation for you specifically. And then when you're picking a collagen supplement, we want ones that are bioavailable so that your body recognizes. So obviously something that's processed over and over again, it's going to become less bioavailable. So right now I really like bone broth protein, and it doesn't have to be like drinking bone broth, even though I don't mind. I think you can make it taste good. But bone broth protein is very bioavailable. There's also some really good vegan options that are more, not animal based. So you really want to look for a collagen supplement that has very minimal ingredients, just like a lot of things, because we want your body to see it, recognize it, and use it. And I think it's totally worth it. But I will say you have to do it for 3 months to notice any difference, because that's how long it takes for your body to build those new proteins and to show those effects externally.
Okay, that was so helpful to hear and makes so much sense. And I love the way you describe things, and it's just, you're just a wealth of knowledge, and I loved learning from you and hearing all about your wisdom. And thank you so much for joining me on this episode. It was so nice to have you. Okay, my loves, thank you so much for listening to today's episode. I really love hearing from you all about how the show resonated with you, and would love it if you sent me a DM on Instagram to @herbodywisdom to keep the convo going. If you are loving the show, it would mean so much to me if you left a quick rating and review on Apple or Spotify. Thank you so much for listening. Catch you next time.